Hello everyone, my name is Jeffrey Perera, and today I'm here at Mayo Clinic's campus in Jacksonville, Florida, with Dr. Barbara Bruce. Dr. Bruce is a psychologist in Mayo Clinic's Department of Psychiatry and Psychology. So, Dr. Bruce, I've already kind of given you a little introduction, but I'd like to ask you, who are you and what do you do?
Well, thank you for inviting me here today. I'm a clinical psychologist at Mayo. I've been at the Mayo Clinic my entire career. I spent 25 years in Rochester at we call it the Big Mayo Clinic, and down here in Florida the last few years. I'm a pain psychologist. I work with patients with chronic pain and other chronic health conditions. So I've developed and directed a number of clinical programs helping those patients.
Oh, beautiful. So tell me about your childhood and how you found yourself pursuing graduate school and eventually ending up at Mayo Clinic.
Wow, that's a good question. I grew up in Baton Rouge, Louisiana. I went to LSU, go Tigers. I didn't know what I wanted to be when I grew up. I thought about being the first woman who ever went to Harvard Law School. That's what I thought when I was 8 or 9. So I was a little ambitious as a kid. I went to college and I tried pre-law and I tried journalism and I wasn't finding it. In my sophomore year in college, I took my first psychology course and it was bam. It was incredible. I couldn't believe that people got paid for getting to do this. It was so interesting, and it felt so easy and comfortable to me.
What did you find interesting about it?
People. How do people tick? How does it work? How do people struggle? How do people get better? Everything about psychology was fascinating to me.
Who is one person that inspired you to pursue your interest in the sciences?
I will tell you that first professor, Dr. Ed Timmons, I'm sure he's no longer around. He used to teach an undergraduate course in psychology, adjustment psychology, and he would fill a 400-person room. It was standing room only. He was such an entertainer, but he made really complex clinical problems come alive. What an inspiration. Unbelievable. And I had an opportunity to work with him closer and do a practicum as a senior in college and got to live and work on an adolescent psychiatric hospital unit. And he was just quite an inspiration to do something important in psychology.
So one of your areas of expertise is in understanding the role of multidisciplinary psychosocial factors in treatment. So what exactly are psychosocial factors and why are they so important to research?
So I had such an opportunity to take my first job at Mayo Clinic. My interest developed over time into the field of health. To be able to work side by side with the best the physician scientists in the world was just incredible. So I could bring the psychological piece, the psychosocial piece to that medical piece, and what a combination in terms of trying to help people in almost any disease, but pain became really the area of my biggest interest.
Can you, for the folks out there that might not understand what psychosocial means, what is psychosocial?
Psychosocial, all the pieces of you as a person, your history, your learning, your exposure, what's important to you, what's irritating to you, your environment. It's kind of the whole gambit of what is a person in addition to their biology. So psychosocial, it's the other two legs of that stool.
Mm-hmm. What qualities do you believe make a great doctor?
Compassion, brilliance, patient-centered. That's one of the things that drew me to Mayo. That's their fundamental belief. Patients come first. Doing the right thing for the patient every time.
So what is one moment when you realized you knew you made the right career choice?
So I have a bunch of kids, and I've helped them along the path to what they're going to be when they grow up. And that's been what an honor, what a struggle. It's hard for kids to find their way. I think I was able to say to my kids, if you find what you love, you'll never work a day in your life. And I felt like I have had that privilege, which is incredible.
Now, what part of the brownie is the best, the center or the corner?
Center.
Center. What was a tough time in your career and how did it change you for the better?
Probably trying to raise children and have a career. I was the first woman psychologist at Mayo. When I joined the staff, there were less than 5% of the hundreds of Ph.D. and physician staff. Less than 5% were women. I was determined to have it all, and it was pretty brutal a lot of days to raise 3 children and have a full career and climb an academic ladder and do things that are meaningful clinically in research. It was a lot of late nights, but super rewarding.
What would you say are your future goals in science?
I mentioned to you a few minutes ago, I just started a master's program at Florida State University, kind of a collaborative effort between Mayo Clinic and their medical school and their College of Graduate Entrepreneurship. And I have developed a number of programs for patients over the years of my career, and I want to learn more about how to get my ideas to patients, how to kind of work through the funding and the resources and the I have lots of ideas. So I'm very excited to partner with people who know the business side of it. That's never been part of my training, but it's always been very interesting to me.
Now, what does your daily routine look like?
In terms of work, life, me. All of the above. So I have 2 dogs that are adorable. A 92-pound golden doodle named Peter and his buddy Charlie. I go to the dog park twice a day, first thing in the morning, after work. That's part of my routine. I teach a number of courses that are really clinical courses for patients with pain. So I teach a good chunk of my day. I see patients for evaluation a good chunk of my day, and I'm engaged in research and writing as part of my day. Now I go to graduate school at night.
So tell me about the strategy and the mindset behind your role. What does it take to be Dr. Barbara Bruce? Especially since you mentioned that you were the first woman psychologist at Mayo Clinic. That's impressive.
Thank you. My daughter asked me if I wore a bonnet when I came across the prairie. It was such a long time ago. I'm teasing. What is it like? I think that I see patients with a variety of pain disorders and other struggles, and I think that I've been doing this for a long time. I am amazed every day that almost every single patient that walks into my office has a different story and a different set of circumstances and a different struggle that keep me highly engaged every single day, even after all these years. I hope I never lose that. If I do, it'll be time to do something else. But they inspire me for answers. They inspire me for being present. They pull at my compassion, and they make me really excited and happy to be at Mayo, where I can usually harness tremendous resources to help them. That's very fulfilling.
What would you say is the most challenging part of your job?
So pain patients are hard. There are a lot of people that find that work too hard. People in pain are miserable, and they're often irritable, and they are frustrated. And so that combination of emotion can make people feel worried and inadequate to meet the challenge. I find these patients to be incredibly brave, resilient, so appreciative of your concern and your willingness to try to help. And I see them get better. And so I think that they are never easy and are always really important.
What would you say is your greatest achievement as a doctor so far?
When I was in Rochester at Mayo, I was the clinical director of a 3-week intensive pain rehabilitation program. I did that for a number of years. We started to see more and more adolescents and young adults come into the program, and this sort of structure for adults just wasn't getting it for these young people. These teenagers and young adults were missing their lives. They were missing school, they were missing sports, they were missing social. Anyway, I went on to develop a pediatric pain program modeled after the adult program, but very much geared toward teenagers and young adults. We would take kids up to about 25 who were not living their lives. They were still functioning like 14-year-olds because parents were doing everything. I, together with a group of very talented colleagues, we built the largest pediatric pain program in the world. My greatest achievement, I set as a goal that every single kid would go back to school full-time the day they left the program, because school was everything. That's where their peers were, that's where their passions were going to be found, that's where there were teachers that could support them and inspire them. And we hit that mark in that program almost every single time.
Wow.
These are kids that had been in school for 2 and 3 years and were behind and upside down and frustrated and yeah.
So how do you approach a program like that? What is the approach behind a pain rehabilitation center?
Well, the first part of the approach is we're going to bring physical therapy, we're going to bring occupational therapy, we're going to bring medicine, we're going to bring psychiatry, we're going to bring psychology, nursing, all kinds of professionals together, and we're going to solve this problem. So what is it that makes it difficult for you to be able to go to school? What makes it difficult for you to be able to sleep through the night? What makes it difficult for you to be able to be with your peers and to be able to interact? In the program, we had parents in the program for 3 weeks as well. So we were teaching them, as kids got better, how do you let go? How do you support? How do you shift gears? Because parents were mostly very frightened for their kids and very scared of what the world would do, much less what their illness was doing. So the parents were integral and amazing as well.
And last but not least, do you have any advice for the younger generation of up-and-coming doctors and scientists out there who may or may not be watching this video?
First off, psychology is fascinating. It's one of the biggest majors of undergraduates, but most people don't keep going. They go and do 1,000 other things. I think it is absolutely fascinating. Human endeavor, for everything from sports psychology to all the issues related to old age and dementia. There are so many pieces of psychology that are so fascinating, and the research is on fire, and I think the future depends on us. Every time I think we do something better, more problems pop up. The field of addiction, the pandemic and isolation, the teenagers who are feeling so hopeless and pulled away from their worlds. We have a lot to do. Please, be a psychologist. Join us.
All right, everyone. Dr. Barbara Bruce, thank you so much for being here.
Thank you for inviting me.
Bye.